10 signs of a heart attack without warning. Recognize them to save your life. Heart attack, or myocardial infarction, is one of the leading causes of death in the world, including Vietnam. What is worrying is that heart attacks do not always come with severe chest pain like in the movies. In fact, many people experience silent, atypical signs, causing them and their loved ones to be subjective and not handle the situation promptly. This lack of awareness is the cause of many unfortunate deaths. In particular, middle-aged and elderly people, people with underlying cardiovascular diseases, diabetes, high blood pressure, etc., are often susceptible to myocardial infarction without feeling clear warnings. Some signs even appear hours or even days in advance, but are often confused with fatigue, digestive disorders, or stress. Therefore, early recognition of abnormal signs of the body, even the smallest, is extremely important. Timely detection and timely emergency calling can save your life or that of a loved one. This article will help you understand 10 common but often overlooked signs of a heart attack, thereby improving your ability to react quickly in emergency situations. Read on to equip yourself with knowledge, because every minute that passes can be life or death. In this article, we will learn about 10 little notice signs that could be manifestations of an impending heart attack, along with specific scientific analysis. Let's get started. 1. Unusual and persistent fatigue. Unexplained fatigue, especially in women, can be an early sign that the heart is not getting enough oxygen due to clogged arteries. A study by the American Heart Association, AHA, found that more than 70% of women experience extreme fatigue in the weeks before a heart attack. When the heart doesn't pump blood efficiently, the body has to work harder to maintain vital functions, leading to a feeling of exhaustion, even without strenuous activity. 2. Shortness of breath or shortness of breath. According to the Journal of the American College of Cardiology, shortness of breath occurs in about 40% of people with pre-heart attack symptoms, especially when the heart can't pump enough blood to the lungs to exchange oxygen. Lack of oxygen in the blood and pressure on the left ventricle cause congestion in the lungs, causing a feeling of shortness of breath. 3. Pain or discomfort in the chest, even if very mild. Angina is a classic sign, but it's not always severe. Many people, especially women and older people, only feel a dull ache, a feeling of pressure or burning in the chest. Narrowing or blockage of the coronary arteries causes myocardial ischemia, resulting in pain or discomfort that usually lasts for a few minutes and then goes away on its own. 4. Nausea, heartburn, or indigestion. Many patients confuse the symptoms of a heart attack with digestive disorders. Nausea and indigestion are quite common symptoms in women in clinical studies of myocardial infarction. Ischemia to the digestive organs or stimulation of the vagus nerve when the heart lacks oxygen can cause a feeling of fullness and nausea. 5. Cold sweats. Unlike sweats due to exercise, cold sweats that appear abnormally, not due to weather or physical activity, can be a sign of cardiovascular stress. The sympathetic nervous system responds to the lack of blood and oxygen to the heart by activating the sweat glands as a survival response. 6. Pain or numbness in the arms, neck, jaw, or back. According to the AHA, many people experience pain that radiates from the chest to the left arm, neck, shoulder, back, or jaw due to the general stimulation of sensory nerves from the heart area. Heart attacks are not confined to the chest, but spread to the distribution of spinal nerves, especially from C5, T4. 7. Sleep disturbances. Poor sleep, waking up in the middle of the night, or feeling nervous when lying down may be related to cardiovascular stress. When the heart is not working properly, the brain and other organs may lack oxygen during sleep, causing discomfort, insomnia, or anxiety. 8. Irregular heartbeat or palpitations. An abnormally fast heartbeat, palpitations, can be a sign of arrhythmia caused by heart muscle damage or myocardial ischemia. This reduces the heart's pumping efficiency, puts pressure on the heart chambers, and can lead to atrial fibrillation or ventricular fibrillation, the two most dangerous types of arrhythmia. 9. Feelings of anxiety or fear for no reason. Sudden anxiety, A feeling that something is wrong or fear of death are common psychological reactions to a heart attack, especially in women. Lack of oxygen to the brain and organs can disrupt the functioning of the amygdala, causing feelings of fear for no reason. 10. Dizziness or fainting. Dizziness, lightheadedness, or fainting can be a sign that the heart is not pumping enough blood to the brain, a condition called acute cerebral ischemia. When the coronary arteries are blocked, blood pressure drops, the brain lacks oxygen, causing a feeling of lightheadedness, loss of balance, or even loss of consciousness. Conclusion: listen to your body, respond in time. Never ignore the above symptoms, especially if you have risk factors such as high blood pressure, diabetes, smoking, obesity, or a family history of heart disease. If you or a loved one experiences 2 or more of these symptoms, especially if they occur at the same time, call 911 immediately. Time is heart muscle. The sooner it is detected, the higher the chance of cure and recovery. If you find the information useful, don't forget to subscribe to the channel and share the video to spread this knowledge to more people. Your support is the motivation for us to continue bringing quality and meaningful health content.